Did you know that more than 6 million children in the United States have been diagnosed with ADHD? Yes, that's right. ADHD, or attention deficit hyperactivity disorder, is far more common than you might think. But it's not just confined to children. It's estimated that around 2/3 of these kids will continue to experience symptoms into adulthood. And it's not just a local phenomenon, it's a global one, with approximately 1 in 20 people worldwide affected by it. Often, ADHD is misunderstood as a condition of simply being hyperactive or inattentive, but it's way more complex, involving issues with executive functioning skills which are essential for self-regulation and managing daily tasks. One intriguing fact you might not know is that ADHD is typically diagnosed around the age of 7, but symptoms can appear as early as 3 years old. So ADHD is not just about being hyperactive and inattentive. It's way more complex than that. Stick around to delve deeper into this subject. Before we dive into the causes and symptoms of ADHD, here's a quick suggestion for you. Why not hit that subscribe button? It's like a virtual high five, and who doesn't love those? Now that you've hit that button, let's move on to the real meat of the matter, the causes of ADHD. ADHD isn't caused by too much screen time, a sugary diet, or bad parenting. It's a bit more complex than that. The roots of ADHD are primarily embedded in our genes. Yes, ADHD can run in families, and studies suggest that genes play a significant role in determining who gets ADHD. Aside from genetics, certain environmental factors can also contribute to ADHD. Exposure to harmful substances like lead or prenatal exposure to alcohol and tobacco can increase the chances of developing ADHD. And let's not forget about brain injuries. Certain injuries to the brain, especially the frontal lobe, can lead to behaviors similar to those seen in ADHD. This area of the brain is responsible for decision-making, problem-solving, and social behavior, functions that are often impaired in individuals with ADHD. This certainly isn't an exhaustive list, but it gives us a glimpse into the complexity of ADHD causes. Knowing the causes is just half the battle. Let's now explore the symptoms to watch out for. ADHD isn't just about not being able to sit still. It's a spectrum of symptoms that can affect every aspect of life. Let's delve into the primary ones. First off, we have inattention. This isn't merely about forgetting to take out the trash, it's a pervasive difficulty in maintaining focus, particularly on tasks that don't offer instant gratification. Ever tried to read a book while a TV is blaring in the background? That's what it's like for some folks all the time. Next, there's hyperactivity. It's not just about being full of beans, it's a constant internal motor that doesn't seem to switch off, leading to fidgeting, restlessness, and a feeling of being on the go. Lastly, we have impulsivity. This isn't just about making hasty decisions, it's a struggle with delaying gratification, leading to interruptions in conversations, impatience, and acting without considering the consequences. If you're seeing these signs, don't panic. There are numerous effective treatments for ADHD. ADHD might be a lifelong condition, but it's definitely manageable. There are a variety of treatments available, each tailored to the unique needs of the individual. Medications, for instance, can help manage symptoms by improving concentration and impulse control. They're usually the first line of treatment, but they're not the only option. Behavioral therapy is another effective method. It can help individuals with ADHD develop strategies to manage their symptoms in day-to-day life. This might involve learning new organizational skills or coping mechanisms to handle stress. Lifestyle changes also play a crucial role. Regular exercise, a balanced diet, and adequate sleep can all help reduce symptoms. Some may even find solace in mindfulness practices like meditation or yoga. The key is to find what works for you, and that often involves a combination of treatments. So, don't be afraid to explore different options. Remember, seeking professional help is the first step in managing ADHD effectively. Before we wrap up, here's a quick, fun reminder. Picture yourself clicking that subscribe button and being part of our community. Imagine laughing at the comments section, then typing your own witty remark. We hope you've learned something new about ADHD today. Remember, it's okay to ask for help. Stay tuned for more informative and engaging content.